Good afternoon, and welcome back to the HealthLeaders The Winning Edge program, a weekly series of webinars touching on the topics and strategies that you need to know most. My name is Jay Asser. I'm the CEO editor for HealthLeaders and will serve as your moderator for this session. Today's webinar is titled The Winning Edge for Rebuilding Patient and Public Trust. Thank you to you and our audience for participating. Before we get started, for those of you participating for the live program, I have a few housekeeping details to go over. Our program will be approximately 60 minutes in length. Note that an on-demand version of this program will be available on our YouTube channel on Friday and can be accessed through our website at healthleadersmedia.com. To ensure you can see all the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. Next, you will find a resource list for today's webinar on the upper right of your screen. Here we have listed the webinar slide deck and some additional materials for you to download, along with a registration link for future The Winning Edge events. At the bottom of your console, you will find multiple widgets that you can use. To submit a question, click on the Q&A widget. It may be open already and appear on the left side of your screen. You may submit questions at any time during the presentation. However, please note that it is likely that your question will not be answered until the Q&A portion of the program at the end. Finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. At this time, it is my pleasure to introduce our panelists for today's discussion. We have Ben Davis, President and CEO of Glencoe Regional Health, and David Hartberg, Administrator and CEO of Vernon Memorial Healthcare. Thank you both for joining us today. Could you please each tell us a little bit about yourselves and your organization? David, can you kick us off?
Yes, good afternoon, everybody. My name is David Hartberg. Like you said, I'm the CEO at Vernon Health. We are a 25-bed critical access hospital independent in western Wisconsin. I've been here about 5.5 years. I'm a rural hospital CEO for over 26 years in rural healthcare.
Great. And Ben, can we hear a little bit about you and your organization?
Yes, I'm Ben Davis, President and CEO here at Glencoe Regional Health. We are a 25-bed critical access hospital with a 108-bed long-term care facility, 40 apartment independent living center, as well as 3 clinics throughout the region. We are located about 50 minutes about southwest of the Minneapolis, Minnesota area. So we're close to Vernon Health.
Thank you both again for joining us today to discuss an important topic that has been affecting the industry. Public trust in healthcare and in providers particularly right now has eroded since the COVID-19 pandemic. Between misinformation, lack of transparency, and widening disparities in access to care, many communities are questioning not just the healthcare system, but the institutions at the center of it. Hospital and health system CEOs shoulder much of that responsibility for rebuilding the credibility and confidence that are foundational to delivering quality care. So with that said, I want to start today's discussion off by asking, from your vantage point at your respective organizations and in your respective roles, what are the biggest reasons public trust in healthcare has declined over the last several years? Ben, can you please kick us off on this?
Certainly. Well, there's certainly been an erosion of public trust, and I think there's 3 converging factors just overall. First was the pandemic exposed some inconsistencies in the messaging, either from national agencies to local providers, which created a lot of confusion and skepticism from the public. The second is the politicization of health decisions, which blurred the line between science and opinion. And then third, the rise of digital misinformation that's made it really hard for patients to discern credible resources. And so historically, our providers, mostly physicians and now APPs, have been that resource, but some of these factors have really created some challenges for our providers in being that trusted resource.
And David, I want to ask you the same question. What are you seeing from your perspective as the main reasons for why trust has eroded over time in the recent years?
I think it's certainly all the things that Ben mentioned as certainly main points for that stuff. I guess one thing I would add is I think that we are creatures of what we already know, and we use that as a point of reference. And I don't know if I'll owe her something for mentioning her name, but the writer Brene Brown said in one of her podcasts early in the pandemic, she said in her Southern drawl, "I don't know about y'all, but this is the first worldwide pandemic I've gone through." And we kind of use that as kind of a point in our own organization for us all to acknowledge as individuals and as organizations, we were doing something we didn't have a whole lot of experience in. And I think our public was going through that same thing. In that, again, they had nothing to relate it back to as a point of reference to then maybe manage through all the things that Ben mentioned in terms of the differences in information and where they were coming in from. Were they reputable sources, or were they maybe questionable resources? And it just added to people's confusion and frustrations.
And the idea of public trust and trying to build it back is not just a PR issue, of course, but a core issue that affects care delivery and hospital performance at your organizations and for providers everywhere. So I want to ask, why is it and how is it that it affects your core operations and basically seeps into everything you do? David, can you kick us off?
I think Ben and I both approach it from the size communities that we are in, and all due respect to our colleagues that are in metro areas or even larger suburban areas, they've got a larger community that they're trying to connect with. I'm guessing Ben's examples are similar to where we have lots of connections in our communities that can assist us in messaging, understanding, being our mouthpieces. And so, again, they can speak to who we are as an organization. I faced an interesting challenge here that I started here at the end of 2019 and had about 95 days before the pandemic hit. And I was a brand new CEO, the first one from outside the organization in the previous 35 years. There had been a longstanding CEO, and then my predecessor was someone who had been in the organization their entire career and had stepped into that. So for me, not knowing the pandemic was coming, I was going to spend my first 30, 60, 90 days making incredible connections inside my organization on who is this David guy and what is he all about, but also out into the community. And I remember my assistant saying, "Gosh, you're spending a lot of time meeting with people in the community." I kind of needed to help her help me in setting aside that time to meet with the local car dealer and to meet with the mayor. And then I said, okay, who are the informal leaders that are in the community that might not show up on a list somewhere, but they had a large influence. And so, like I said, unbeknownst to me that I would be needing to leverage a lot of those relationships as the new CEO here in Viroqua, I was trying to establish those relationships so that I could be seen as a connection from Vernon Health out into the community and vice versa. Hopefully we did that okay, and that paid out dividends later on as the pandemic continued to impact our community.
And Ben, I'll ask you the same thing. Why is building back patient trust not just a PR issue, but one that affects kind of everything you do at your hospital?
Well, I think it affects patient behavior. And, when patients trust us, they're more likely to seek care early, follow our treatment plans and engage in preventative maintenance. And so I think what's happened is, we're seeing patients delay care. We're seeing some higher readmission rates and staff burnout. I think here, here in many areas is that we got to keep establishing trust between our providers, our nursing staff, and we have a very, very engaged nursing staff, engaged provider group, and population here in healthcare. But we have seen some challenges with vaccines now in our younger population not reaching out, and then have seen some rises in COVID as well as flu in our area. So it's affecting the health of the population, and we got to continue to work to build back. And not that we necessarily lost the trust, but there's so much information that's coming at them that is contrary to what we're saying as a provider group to our patients.
Yeah, just want to follow up on that and ask you a little bit about the idea that before the pandemic happened, hospitals and providers were seen almost as, people who are doing good in the community are these local heroes that are serving communities. And how have you seen that, how people are viewing you as a hospital, as a provider, change over time? Do you still feel like there is that sense that you are a bastion of good in the community, or have you found that to be to change over the last few years? Ben, I'll ask you first.
Yeah, I still think we're making a positive impact in the community, and I think people do trust us. We are one of the largest employers in our community, and so what we've found really effective is that when we have our staff talk about the importance of the care we're providing and the importance of patients following our care plans and treatment plans and engaging in preventative health, that word spreads throughout the community. So it's really a word of mouth campaign that sometimes we've seen be really effective in navigating some of the trust factors. And also just having really quality providers and being that trusted source of information.
And David, how have you seen kind of that dynamic shift in recent years?
Yeah, I think we've maintained a high level of respect and presence with our community. We happen to sit in a community that has a very low vaccination rate pre-pandemic, so high vaccine skepticism. It's something that us and public health and many other entities have tried to work on. And so certainly when the COVID vaccine came out, those were some pretty tense days, knowing that we were, again, sitting in a community that didn't do lots of other vaccinations. We started to navigate through the situation of needing to have our own employees vaccinated unless they had declinations. Again, I remember a couple of conversations with our leadership team about, what were we going to potentially face? Luckily, we had a couple physicians who stepped up very early in the process and were very public about their own opinions about vaccines and what could be done. And I think their established respect in our community, not only with our employees, but with our community, helped to change that narrative, that they looked at the faces of those people and said, those are doctors that have been in our community for 20, 25 or more years. They've delivered our babies. They've done this other good work. And really, kind of went out on a limb that it was during a tough time for people to take a stand on something. And I think that helped to pave the way. So it'd be hard to say that everything was cushy and went great. I think there were a lot of times where it was really touch and go. But I think overall, we maintained that. I think the last couple of years has been tough as we've maybe sensed some other people that are in our industry that are in the healthcare space have maybe started to also question our motives and what we are about. And that's the hardest part. We're all trying to take care of patients in our own way. And when others are questioning what our motives are in serving our community, just got good people that are giving tirelessly. And again, that was probably the most frustrating part during that time period was seeing the hours that people were putting in and where they were putting themselves on the line for this community. And I know a number of our providers felt some moral distress during that time. Not being trusted.
Yeah, both of you have mentioned, obviously, vaccinations. And I think that came to the forefront at the pandemic in terms of lack of trust between from the public to providers. But where else have you noticed maybe these trust gaps in your organization, whether with patients, staff, and how do you go about identifying those? Ben, can you kick us off on this?
I think there's quite a few different areas that we look. So first, we look at our patient experience survey that we do in multiple areas, whether that's the medical clinic, that's the ED, that's surgery, inpatient, and utilizing and identifying areas of concern through those. The other is we do an employee engagement survey every year and getting the feedback there. And then we just listen to our staff, providers, and community. So, many of our leaders are part of organizations throughout the community. I meet with our city administrator. We meet with local civic groups like our Rotary here in Glencoe. But really, I think for us, it's really a word of mouth to identify where are people seeking advice, maybe outside of the structured medical community that we would recommend.
And David, where are you seeing those trust gaps, and how are you going about identifying them?
I think a couple of different things we've tried to leverage. First of all, when I came to the community and I was going out and about and meeting community leaders, I asked, where do groups get together and informally talk about things? And everybody kind of said, well, we really don't have a group here. We've got the formal groups, but the informal groups didn't exist. And so I just started up a group, about 8 to 12 of us that get together regularly and talk about different things that are going on in our community. We each get a 5-minute start to kind of talk about what's going on inside our own organization. It's meant to be pretty private and a pretty safe place to have those conversations about things and just have as a bouncing board off of each other. Again, maybe places where other conversations couldn't occur. We have a really, really strong chamber of commerce here for a rural community and tried to leverage that early on. And I know that helped us to be able to connect with lots of businesses that were looking for information, didn't know where to go to that, and felt comforted that they looked to us to be that source of information for them on how to run their own businesses. And we certainly said we're not going to tell you what you can or should do, but we can provide advice and guidance on things that we're trying to do in our own organization and navigate through those things. And so again, it's not only pandemic related, but as they try to navigate other things and how they care for their employees, what they're looking at as far as health programs, again, comforted that we've been able to establish ourselves as a resource that they'll pick up the phone and ask those questions of our organization, our providers, and the leaders.
So when you're talking about trying to regain this trust and rebuild it, what does success look like when it comes to that? How are you measuring the progress that you're making or trying to make within that? David, can you start us off?
I think that the number of the different things that Ben mentioned in regards to patient surveys and employee surveys are great things. I think, quite honestly, while it's not measurable, it's when you have someone approach you with a very, very hard message. They trust you to receive that message. They trust that you're going to do something with that message. And so there's not a week that goes by where, an employee can come up and say, I had an experience last week where an employee came up with me and felt like there was something that was being misconveyed in our organization. She didn't feel like the clarity of what was occurring and what she was hearing was accurate. And she wanted to be able to share with me from her perspective what she was seeing about some care delivery things going on in our organization. And so to me, that there must be a level of trust that she believes she can come and share things that is probably not going to be easy for me to hear. Probably not things that we want to have people perceive about our organization. And she can share them with a comfort that, again, she's going to be heard. We're going to look into those situations and we're going to come to some kind of a resolution on where are their validities in that. And so whether that's from an employee or from a community member that shares those things, Ben and I both love the great messages when our organization's doing all the great things, but we need to have the trust with our employees and our community to hear what's not going right or not landing the way that we want it to.
I'll ask you the same thing. How are you measuring that trust, that progress towards trust?
Well, I agree with David. The surveys, the measurable, the metrics that we have are certainly an indicator of trust. But I think what David hit on is when there's open communication about some of the things that may not be going as well as you'd like them to, and that the community, staff, providers are comfortable having those conversations with you. I always say to our team is, if we don't know or we aren't hearing things that we can improve on, then we're doing something wrong with trust. And I think trust is the core foundation of having a great team, a great organization, and a great impact in the community. So I hear you, David. Last week I had a staff member come forward and say, "Hey, you know what? I think we're missing the boat here, and we've got to do better." And so we're meeting to determine how do we move forward in the right direction. But having her feel comfortable, be able to bring this forward is an indicator of trust. Not necessarily measurable, but it is something that we want to hear, and will continue to do so.
And as you try to measure success, what role does data play into this? How can you use that, whether to your advantage, to measure that trust or to inform your efforts to kind of build it back right now? Ben, have you found any instances of that right now?
Yeah, I think it's more than one metric that we're using. So it's patient surveys, it's employee engagement, it's market share. If people don't trust or find that they trust another organization more than they trust us, that's an indicator that they're willing to go somewhere else for their care. And so we do look at those fairly significantly. We look at, our people accessing our care. And so those are probably the three areas: employee engagement, patient engagement, and then market share overall.
And David, what have you found with your use of data in terms of trying to rebuild some of this trust or measure it along the way?
Yeah, I mean, I think we use the same elements. Maybe we look at different questions differently in terms of their prioritization of which ones drive the bus forward. Certainly, likelihood to recommend on our Press-Ganey surveys are huge. We were seeing some gaps relative to how departments work together, and put in place some countermeasures this spring that we're asking the organization to work on. Things like doubling down on AIDIT and some of those elements with that again conveys to the employees again. And we've seen that, actually, we've seen dramatic increases in our ER scores, celebrating them 3 months in a row and having outstanding improvements in that. And ER is a tough space right now for all of us. We're seeing more and more people utilizing the emergency room. And so it's meaning a little bit longer wait times. We still have incredibly short wait times relative to probably what our peers in the urban centers have, but a community gets pretty used to just walking in and getting care right away. And so if there's a little bit of a wait, they think that that's something that's not making them feel trustful or cared for in an organization. And so again, utilizing data kind of focused in on a couple different areas that we felt like we needed to focus on to go forward, to build back that trust and communicate effectively. What should they set as expectations for when they present to us for care?
I want to talk to you, ask both of you now a little bit about the way transparency factors into all of this. Of course, you want to, as providers, as hospitals, give as much information as you can to your patients, to keep them informed. But how do you also strike a balance between being transparent and not overwhelming patients with too much information, especially in healthcare with medical information that can be very nuanced or technical? How do you strike that balance as best as you can? David, can you start this one off?
Yeah, I love this question mainly because it's one that I think we are continuing to struggle with, but lots of conversation about it. I have had the opportunity to sit on the Wisconsin Hospital Association board for a number of years, and we regularly have some of our state legislators come in and speak with us. And one legislator came in probably about a year and a half ago. He himself pointed to a board at the state level running healthcare, and his message to us was, you need to tell your community more about the trials and tribulations that you're going through. If they don't know about what you're going through, they can't come to appreciate it. And I heard those messages, and yet after he left, we all kind of sat around and said, okay, but how do we do that to the point where we don't really concern our community? We don't freak our community out. His point was, you guys do it so well. It's like your ducks paddling, smoothly across the top of the water, but underneath you're paddling like crazy. And yes, many times, both pandemic and afterwards, we do feel like that. Our staff feels like that. But again, I think we continue to struggle to think of how much do we let our community know about that. We want to look like the smooth gliding duck on the top of the water. They're already dealing with lots of things as patients. They're dealing with pain and confusion and frustration over what's going on in their life related to their health care. And so I think in a number of different ways, again, both pandemic and post that time period, we've relied upon, I guess, trying to pick small little snippets of information, not putting them out too often. We've been trying to drive more people to our website and to other forms of communication. And so we've seen, luckily, an increase in that. And so people are finding those channels. But we continue to look for new ways to connect with people. One of the unique nuances our organization has is we've got a large Amish and Mennonite community that we serve. And so social media and other means are not going to be a way in which to connect with them. And so we're spending time both in print as well as making face-to-face connections with the leaders of those communities to try to, again, formulate relationships, be in their space when invited, and it helps us to connect with them and make those connections and relay accurate and timely information.
Yeah, Ben, can you add on to that in terms of how you're finding that balance that you're trying to strike between being being transparent but also not overwhelming patients?
Yeah, I think we've had a focus on simplification, and how do you be clear and effective while also communicating the full message? It's certainly challenging. So we're trying to. I think our providers have done really a good job of being as healthcare is complicated. So being as clear and concise as possible. We still struggle to not be too technical because what we do is very technical. And so it is a conversation. I think the one thing is that we're really good at having conversations. Our providers are really good, nursing staff, about and getting to the core of the issue. I think overall, though, to David's point, sometimes, especially with legislators, we really want to pick our battles. So we don't want to cry wolf at everything. And I know sometimes they're like, well, tell us about everything. Well, there's a lot going on. But we really have to be consistent. And I would also say to our community, I think, looks to us to be that consistent, steady Eddie, where we provide care. We're here 24/7, 365 days a week. Our emergency department's always open. Our inpatient unit's always open. Our long-term care facility is always open. We are this steady organization within our community. So it is certainly a challenge, Jay. We'll continue to work on it, but would be interested if somebody watching has any recommendations on how to strike the balance between being transparent and not overwhelming patients with too much technical information.
Jay, maybe I've got a follow-up to that. A good example. We've rolled out in the last couple of months, AI ambient listening in our clinics, and was rounding with one of the early adopters of that, and we were having a conversation with him and two other providers, and I think one provider will probably eventually want to go that route. I think the third one probably will never use ambient listening for a multitude of reasons. But as the one that was the early adopter said, what he just says to his patients is, I've got my robot friend here, and is holding up his phone, and it's going to help me to be able to, listen to what's kind of going on and be able to keep track of what we're talking about so that the note can correctly reflect what we had as a conversation about. I can do that, but it means I'm doing two things at once, and the robot just kind of helps me be able to assist with that. And I thought, what an easy, simple explanation in 20 seconds or less that described a little bit and certainly got the approval of the patient for what they needed. But by calling it a robot, using plain language, and what it was going to end up doing, again, it ended up giving not too much technical information. Oh, it's AI. Oh, it's this. Oh, it's that. Things that could have easily overwhelmed a patient, and they would have been against it, or they would have gone along with it, but maybe begrudgingly. He got a simple and easy endorsement for that. And I think that maybe is a good example of where we don't have to overcomplicate it. We don't have to use big words. We're an industry that we have those and we can use them. And it makes us sound really smart, but again, does it mean that we get confusion with our patients? So wherever we can use the term, here's my robot friend that can help me with this, I think those are good examples.
Yeah, definitely. And I think we've talked a lot about transparency. I think access is also a huge part of this trust puzzle, right? We mentioned at the start, the disparities in access to care is causing some of this distrust in communities. So how are you addressing those barriers like wait times, digital access, or language? How do you overcome that and try to reach as many people as possible in your community? David, can you start this one off?
Yeah, certainly trying to build the team as much as we can in primary care and in behavioral health. We're fortunate to land an additional psychiatrist and an additional licensed social worker that will join our behavioral health team this fall. That'll improve behavioral health access. Really haven't seen a huge uptick in patients wanting telehealth. We've been surprised by that, but I think others have equally been surprised that have maybe tried to deploy that as a means for access. Behavioral health has been an area that's had a larger comfort level with that, both in terms of the providers and patients that are wanting that. I think health literacy is an area that we've begun to try to focus on a little bit more through our community health needs assessment, in understanding elements like food insecurity and health literacy are areas that we have to walk into that help to address some of those barriers that we look like an impediment, or that we identify a problem and then we're not able to always provide a solution to it. So we're trying to explore food pantries in our clinics, working with some area high schools to create some food pantries out into the communities. Again, just all different ways of connecting where patients are at and what they're seeing as barriers to health. And then they want us to be obviously a part of the catalyst for solutions to those things. So trying multiple different factors to try to introduce new connections.
And Ben, in terms of how you, at your organization, how you're trying to address those barriers, what are some things maybe that you found to be successful so far?
Yeah, I think like David, we've really focused in the past 2 years over creating access to primary care. That was a main concern for our community 2 years ago, and up until probably last year, the end of last year, we really struggled to get local members into primary care. Since then, we've made some investments and are doing a much better job today. I think the other piece is we have a largest Hispanic community, and we've on-site interpreters and some providers that speak Spanish. That's been really helpful. But I think there's some more that we can do there. As far as wait times, we really don't, the emergency department wait times are, you can come in and walk in. We also have an urgent care where we really don't have to wait. You may wait for 5 minutes, 10 minutes to get in, but that's been pretty good. As far as digital access, that is something that we, through our electronic medical record, have had some issues with trying to create online scheduling and video visits through that. To David's point, we haven't seen a huge uptick in telehealth, but we do expect that there will be a growing need for that. And I don't think it's one or the other. It's having both, having access to both, and multiple ways of accessing healthcare. So it's multifaceted, but I think you can't let each one, you can't let access slide. I think that's key to keeping trust within the community, is that you have to have access to services, and your communities are depending on you for it.
Of course. And we've talked a lot in this discussion so far about trust within the public, within your communities, but there's also that element of trust within your own walls, right? With your own staff, your own workforce. And that is just as important, and has become, very important during the pandemic and in the wake of the pandemic. So I want to ask a little bit more about building that trust within your organization, under your own roof. How do you go about involving frontline workers in decision making that can affect them, and what impact do you feel that has not only on their morale and their ability to trust you as leaders, but then that kind of also affecting how the public can trust you and can see that, okay, if frontline workers are engaged and trustworthy, then we can be too. Ben, can you kick us off on this?
Well, I love this question because I believe, we've got a vision, is that we want to be the provider of choice and the employer of choice, but I don't believe that we can be the provider of choice if we're not the employer of choice. So we need frontline staff. We need great people to take care of our patients and residents. And so what we've really focused on teams that we've created that are frontline staff and some leaders that are focused on patient experience and the employee experience, as well as access. So we've got a couple teams of frontline staff that are really making those decisions and having a positive impact on the morale of the organization, but also understanding what's important to patients. Because sometimes it's easy for us, for me, I should say, to lose sight of what patients really need, and then also what employees really want. And again, we use things like the employee engagement survey, the patient experience surveys that guide, but to get a full picture, we really focus on our frontline staff of leading the charge and being the advocate for both employees and patients as a whole. So that's really been impactful. We've had our employee experience survey. We just got back, or will receive the final information at the end of the month here. But last year, our employee engagement survey was very positive. And so I think some of that work, that engagement by frontline staff in decision making has really made a positive impact. And we're seeing that now through our patient surveys. So I think it's having great people doing great work, caring for our community.
And David, what have you found to be working so far within your own walls, within your own staff, to try to build back that trust and engagement?
Of the care that they provide being shared with them. And so that can be somewhat ominous, but I think it can be even more enriching. So I happened to be sitting in a leadership meeting 2 weeks ago, and my phone goes off, and I usually don't answer it, but this is one of those times where I'm really, really glad I answered it. a person that I knew from another community many, many years ago was driving through our town. And actually, they weren't driving through the town. A family member was driving through the town with a patient who had started to deteriorate. And they pulled into our emergency room and got the care that they needed unexpectedly with that. And that person just wanted me to know how thankful they were that we were there and helpful we were, and all of that. And so in this meeting, I'm able to then share with our ER leaders sitting about 3 chairs away from me and our entire leadership team, hey, we just did something awesome, and how proud of that is for me as the CEO to receive those messages on behalf of the people that did that work. And so that transparency and those connections that you've made in your communities, whether it's your current one or your previous one, I think helps to show the employees that what you do does make a difference. It is transparent. It is aware of it. And people will talk about it. And again, hopefully that's not in an ominous and scary way versus hey, we did good work and it was neat to hear about that we ended up doing those things. So I think that that's some way. And so whenever it is in a patient survey, or if I'm able to receive kudos for our organization on behalf of that, I'm always trying to share that stuff back out. And I think it brings the story full circle. I think the second way is involvement in teams. And here, previously, strategic discussions didn't include providers. It didn't include staff. It was pretty much a very administrative function. And so what was one of the first things I tried to turn around was this administrative team's got lots of skills and lots of talents, but we don't know everything. We need the perspective of all these other key stakeholders in it. And so whether in developing the strategies on a very global or high level, we've involved those people, but even more so when we get into the specific tactics, like how are we going to deploy that strategy? There's frontline employees that are involved in that. So some recent conversations about obstetrical care and some things that we want to do. There's 2 OB nurses that are sitting on that tactic team, and they're helping to advise the other members of that team on how that problem is being faced currently, and what opportunities are there, and what ideas should be brainstormed around those things. I think that ties people back to it, those people that are passionate about it and want to see those solutions. And they go out and then tell the other employees, hey, I really felt like I got to contribute that information. And ultimately, when you execute on many of the ideas that are brought forward, they're like, hey, that was my idea to do that thing over there in the OB area. And then I think that just is a hamster wheel that continues to pay dividends going forward. They feel included and involved, and they feel part of the outcomes that occur.
Yeah, both of you mentioned. Oh, sorry, Ben, go, please.
Yeah, Jay, if I may, to David's point, that's really worked well for us in construction projects when we bring frontline work staff in ahead of making decisions about what we're going to do with certain spaces within our organization. That really creates some ownership around that department that we're remodeling or building out.
I think that's a great point. Both of you mentioned employee surveys really informing a lot of the feedback you're getting from your staff. I want to ask follow up about well-being specifically within your workforce. What have you heard from your staff in terms of things that they want to improve their well-being, both as an employee, but as a person outside of your organization? And are there any initiatives that you found have been successful at addressing that right now? Ben, could you share any examples that you found?
Yeah, we've just really kicked off our wellness and well-being function. We're talking about it more as part of our leadership development for our leaders. One of the things that we instituted a few years ago is we put in a walking trail around our organization, our campus, that has really been effective. So we encourage staff to get out and walk during their breaks, to get out of our organization, out of the facility, because we do deal with challenging situations, and they happen on a day-to-day basis, whether that's with a patient and a colleague or a family member of a patient. And so we need to step back sometimes and get outside and relieve a little bit of stress. The other thing is, we've been having a lot of conversation about time off and encouraging staff to take time off. And I know some people really enjoy work and just want to grind it out, but it is important to take time away to be off campus here, and whether that's with family or doing something that you enjoy.
And David, could you add on to that? Any examples that you found within your organization?
Yeah, we've been really, really pleased to see that our resilience scores in our Prescani employee engagement surveys have typically been top box kind of performance. And so it's reaffirming that we're doing some of the right things to make staff feel like they can detach from work. I think that's probably been the biggest area that we've been in. So we just went live this last weekend with a new version of Epic. And so it was all hands on deck to be able to get through that. And again, lots of leaders visible to try to make, again, employees that were up to their elbows in new changes, feel supported and that there were others there. But we also then came back yesterday and talked with a number of those leaders that we saw there on Saturday and said, so tell me what day this week you're taking a half a day off, or what day you're going to be gone next week. Well, I got a lot of things to do. I'm sure you have a lot of things to do, but it's important that you go recharge and be gone with that. And so one, it's a good humored, but it's intentional to say, you were here during work time that we don't normally expect you to be here. Thank you for being here, but you also need to get away and recharge. And I think that's just even been it. We've had lots of conscious conversations about leaders set the expectations. And so if we ourselves are not getting away, we unintentionally set the message of more work is going to be better work. And so that's hard for me. It's hard for others. I don't want to let anyone down. I don't want to be somewhere where I could be helpful in any shape. And so Fed Eds have some team members tap me on the shoulder and go, hey, buddy, you need to be gone as to set the tone for it's okay for others to be gone. And we've got people and we've got systems, and if the building's on fire, someone will let you know. But other than that, they got it. And I think that's been part more of our conversations within our, not only our senior leadership team, but our departmental leadership team is that we've got good people, trust them to do that good work, be gone. And then it's easier for the frontline employees to also find that space to be able to be gone. You can do lots of different coping mechanisms and bring around free ice cream and do all those kinds of things, but we all do need to disconnect from our organizations, even as passionate as we are about them, and be away. And how's that best get accomplished? I think that's one of the best ways to try to allow that well-being the space that it needs.
Yeah, I think that's well said. Just lastly, before we move on to the Q&A portion, I want to continue with this idea of initiatives outside of your hospital walls. I think both of you have touched a little bit on community outreach efforts that you've made within your organizations, but what kinds of engagement or outreach have you found most effective in rebuilding this trust within your communities, outside of caring for patients, but just going into your local communities and kind of reestablishing that reputation as a provider, as a hospital? Ben, can you start us off on this?
Yeah, in our community, it's being present. It's participating, whether that's the chamber, it's the Rotary, it's a Kiwanis Club, it's participating at a fundraiser for the firefighters. It's participating in our local summer days. It's being present with the community and really being part of the community. To David's point earlier, it's sometimes lending your expertise. For us being one of the largest employer, we also have a lot of the really intelligent people, and especially in our community groups, utilizing those skills from our teams that they've learned either internally or through through their education has really been beneficial for the community as a whole. So it's so important, and it's so important that we're visible, and we found a lot of benefits in that through just community engagement, also community engagement participating in our community health needs assessment that we completed this year. Those things are all important, and I would encourage anybody who's not doing that today to go out and meet with those local groups, and encourage your leaders within your organization or staff as a whole to participate.
And David, what maybe efforts have you found that have been allowed you to really kind of establish a place in the community and grow that presence as a hospital?
We got a great example, ironically enough, tonight. You're both welcome to drive over to Viroqua and be a part of it. Tonight, our foundation is hosting their annual Films on the Field. And so at our county fairgrounds, we have a huge blow-up movie screen, and we end up showing a movie for our community. This year, we're doing a unique partnership with our behavioral health team. And so we are showing the movie Inside Out. And if you haven't seen that movie, anyone on this call, it's called a kids movie. I would argue it's just as good for adults as it is for kids. But our behavioral health team is going to hand out refrigerator magnets with the different Inside Out characters on it, and hand out little orbs that are used in the movie to represent feelings and emotions. And so to talk with people that are participating in this about, again, how families can talk about big emotions and big feelings and how they can be managed, and what terminology we even use to call those things inside us when we don't have a terminology for them, and yet we need to talk about it, whether that's a parent talking to a kid or a kid talking to a parent or sibling to sibling. In addition to that, a couple area businesses are going to donate pizzas and ice cream to have free food that's there. A number of the events that we've held in the area, we've had members tell us, given the food insecurities that are in all of our communities, when we hold an event for the public and there's food there, we might be serving 10, 20, or 30 people that might not have had a meal tonight had we not had that event. That's not the primary purpose for those things. It's a secondary thing. But again, if you can't tell, I couldn't be more geeked out about this in terms of putting on some event to pull the community together. I've been watching the weather like a hawk, and it went from 50% rain to about 83 in sun. So we're good there. But a behavioral health team being there to talk about some things that, again, are usually showing up in most of our community health needs assessments. The food insecurity thing being able to be done by free food that'll be there for the first, I think, 300 people that will be there. Hopefully a great night with a great turnout. And again, a way of being outside of our four walls, out into the community in a location that's easily accessible for people to get to. And I think it's a great example of some of the things we're trying to do to be everything we can be to our community.
It sounds like a great night, a lot of fun. If I get in my car right after we get off of this, I might be able to make it down in time, but I'm sure that's going to be a good time. Thank you both for a great discussion so far. I want to make sure, again, that we leave some time for some Q&A. So this now brings us to the Q&A portion of the program. We'd like to invite all our listeners and audience members to ask live questions of our panelists. As a reminder, if you are participating in the live program, to submit a question, click on the Q&A widget at the bottom of your screen. It may be open already and appear on the left side of your screen. And please note that your questions will remain anonymous by other audience members. All right, so we have a couple questions in. First, I want to throw this to you, Ben. Have you implemented any training or cultural changes with your staff in terms of interactions with patients when they're in your hospital? And have you seen that at all help with kind of regain some of that and rebuild some of that trust?
Yeah, well, one of the things that we instituted this year was a service recovery program. And so we're rolling that out through our Leadership Development Institute, which we have for leaders. The next phase is for staff, and it'll be part of our annual learnings. but also something that we talk about on a monthly basis. So we do, and we have seen some encouraging data from that from our patient experience surveys already. So we're excited to see what more will be coming down in the future.
And David, same question. Have you implemented any in terms of patient interaction with your staff, any changes culturally that has you felt really helped to kind of solidify some of this trust?
You bet. I mentioned it earlier, the 8 acknowledge, introduce, duration, explanation, and thank you. It's fairly well known and utilized in healthcare. And so, basically when we rolled it out to all of our staff earlier in the spring, we acknowledged the fact that you're probably doing 75% of this in your own way. It's probably just a couple missing components. It doesn't have to always go in that exact order. If there's any opposition to feeling as if that would be scripted and overly burdensome, again, you're probably doing it. And like I said, we've seen the biggest increase in our emergency room 3 months in a row here for May, June, or April, May, and June. So we feel like it's had a major impact upon that. I'd encourage people, if they aren't familiar with AIDIT, to go out and Google it and implement it in their organization. Pretty easy to do. Just we need traction from all the staff doing it.
And we'll quickly just sneak in one last question here before we go. I'll throw it to you, Ben. Ben first. What do you think patient trust in healthcare and providers is going to look like in 3 to 5 years from now? Do you think the longer we get removed from the pandemic, time is going to help that? And obviously the initiatives that providers are taking to rebuild that. But how do you see that developing in the next 3 to 5 years?
Well, you're asking me to predict the future. I think, COVID was one thing, but now we're dealing with some social media and where not just young people, but people are getting their news online and maybe not always by reputable sources. So I think we will have continue to have some creep away from being the trusted advisor to those that really don't want to develop a relationship with a provider, right? And so we have not many staff or many patients in the community that have developed trust, that do trust our organization. But I do think there'll be some challenges in the future with misinformation. But I think we have to be able to meet people where we're at. When we talked a little bit about having both an option to meet in person, but also being able to contact somebody via phone and have a visit that way as well. So there's multiple ways that we can continue to develop trust, but we also have to have different ways of being able to do that.
Great. And then David, just very briefly, what is your take on kind of the future of this?
Yeah, I'm concerned. I think that, again, with the divisiveness that are in our communities on a number of different issues, the challenges from what just got passed in the budget in Washington is going to make financial and societal things more challenging. And we're going to, unfortunately, get caught up in the middle of that. I think those that have already spent some time and energy on this topic of trust are going to be better primed for it. But I think there's some very challenging days that are ahead. And it's going to take a very concerted effort to try to maintain or build trust during that time period. Budgets are going to get tight, or healthcare organizations are going to struggle to do the things that they've historically done and have to make some tough choices with it. And again, some are maybe better positioned than others to do it, but challenging times ahead. And so I encourage everybody to spend some time in their strategy talking about maintaining and building trust with their community. Hopefully organizations are already doing that.
Great. Well, that brings us to the end of our discussion today. It's all the time we have for Q&A. In closing, please note that our next Winning Edge webinar program will be on July 22nd and will cover the Winning Edge for Employer GLP-1 Cost Containment. A live clickable link will appear at the close of this program, taking you to our registration page for that event. Remember to follow along all week for continued coverage on rebuilding patient and public trust by visiting our website at healthleadersmedia.com. I want to thank our panelists once again for an excellent discussion. And finally, thank you to you and our audience for participating. We hope you enjoyed today's program and look forward to seeing you during our next Winning Edge program for our employer GLP-1 cost containment webinar. Thank you very much.